Okay, great. So we're all here.
So basically, what we're gonna do here today is just talk about the 3 questions we put on the email, and then we're gonna introduce ourselves, and then it would be good if you guys can introduce yourselves as well. All right, so this is our first VA2P Zoom meeting. I'm Marco Brago, sophomore at Beaufort High School, co-founder of Vaping Attention to Prevention.
I'm also a co-founder of Vaping Attention Prevention. I'm also a sophomore at Beaufort High School.
I'll also be recording this, so we're gonna introduce ourselves, and then it would be good if you guys can introduce yourselves as well. So this is our first VA2P. Oh wait, is this? Yeah, it's recording. Yeah. All right, so this is our first VA2P Zoom meeting. I'm Marco Brago, sophomore at Beaufort High School, co-founder of Vaping Attention to Prevention.
I'm also a co-founder of Vaping Attention Prevention. I'm also a sophomore at Beaufort High School. And I would like to formally introduce Suhas and Alina.
Hi, I'm Suhas. I'm a senior at Chattahoochee High School, and I'm an ambassador for VA2P.
Hi, I'm Alina, and I'm a freshman, and I'm an ambassador for VA2P, and I go to Mill Creek High School.
Great. Yeah, so we're all going through this really troubling time right now. I would just like to know, what have been your experiences with social distancing and staying away from other people?
For me, personally, it's been tough because I'm someone who likes to study and work in a group setting. And I just always love to go to coffee shops and everything, but I have been using things, Zoom and FaceTime, stay connected. And I've been picking up new hobbies, like new forms of cooking, trying to keep myself occupied.
Yeah, it's definitely a big change. A lot of us have to adapt and change what we do on a daily basis, but the whole world is going through it. So
it's been pretty tough too, because you're just stuck at home and you're bored, and so you have nothing to do. But I've been going on runs and walks and cooking and learning how to bake new things. It's hard because you have you have nowhere to go. So
Yeah, what we've been doing is just learning to play poker and stuff. Basically, spending more time with our dog that we got. And it's been pretty good because me and Juan are usually really busy and barely at home, going from soccer practice to school. So I guess this is a good change, to be with our family a little bit more.
That's one positive, just spending more time with your family, connecting more. So,
yeah.
Do you guys feel that way? Do you guys know any positives?
Well, I mean, now we
family
have
time, yeah.
Yeah, now we have more time to pursue our own interests instead of driving from here to school to your activity to back. It's like you're in one place. You have time on your hands to really explore.
Yeah, you have a lot of time to pursue interests that you may not have had time to before.
Yeah.
We've been seeing a lot of, not claims, but ideas that have been coming up in the scientific community that vaping might lead to worse outcomes with COVID-19 cases, especially in youth and young adults. So I was just wondering, what were your guys' ideas on that, and do you guys have any input on it?
Right. So recently I read a study by Dr. Albert Rizza. He's a pretty big doctor at the CDC. So essentially what he said was, because COVID-19 is a respiratory disease, you have a higher chance of getting a lung infection and your lungs possibly collapse. For everyone at all ages, it makes it really hard to breathe when you test positive. And there has been many correlations seen between increased vape use and an increase for lung collapse or lung infection or just any lung issues at all. So essentially by vaping, you are increasing your chances of not getting COVID-19, but getting a severe case of that.
Oh yeah, it's very interesting. Alina, have you seen any research or any?
No, but I feel like if you're vaping, your lungs are more vulnerable to get the COVID-19, and it'll be harder for you to get through the disease if your lungs are if they're damaged already. So.
Yeah, we just read this study because we're in contact with Dr. Galit Southos from Johns Hopkins. And he created a study, basically he said what you were saying, Suhas, about having a more severe case of COVID-19 from vaping. But he also showed a study case of this patient that I don't know if he treated her, he found her her symptoms. She had no other lung issues before, and the only possibility was vaping.
We found his patient actually developed hypersensitivity pneumonitis from being exposed to secondhand vaping. And that's crazy. We haven't seen any studies related to secondhand vaping use ever, really. We think that's one of the first. It's great that they're doing studies on that.
Yeah.
And we've also done some research on the effects of vaping in terms of COVID-19 and worse effects from using vaping. We've actually seen that vaping actually increases the ACE receptors in your lungs. And basically what COVID-19 does is that it attacks to those ACE receptors. So it's a higher chance of developing symptoms, actually catching the disease. Yeah, having worse symptoms, all that.
Yeah.
What we think is that in China, there weren't really a lot of numbers showing that there was young people or young adults, teens, getting COVID-19. But we think that with higher vaping and cigarette use in the United States, we think that that's had an effect.
Yeah, to have higher amounts and higher severe cases in the U.S.
In terms of teens.
You also have to look at the point that like now because of this, hospitals have less beds, they have less ventilators, rooms, staff. Just by itself, vaping on its own can cause issues where you're going to need a ventilator or you're going to need a trip to the ICU. And hospitals, especially, and really getting full to the point that these people can't get that attention. So even if you don't test positive, vaping now can cause issues that you're going to regret in the future.
Definitely.
Yeah.
Yeah. So what do you guys think social distancing, do you think it's had an effect on vaping in terms of use? Do you think it's increased or decreased vaping use and also other high-risk behaviors?
I think personally it's had both effects. It depends on what kind of person like they were initially. There are some kids who are light vapors. They just go to school, they go to the bathroom, they take one hit from their friends, vape, and they come home. And that's all they do. Kids, obviously, they're not going to take that one hit anymore because they're not going to school. They're not meeting their friends. Yeah. They're at home. Parents are like watching over them. So they're going to have less use in vaping. But at the same time, you have kids that are bordering or sometimes are actually addicted to the point that now that they're at home, they're going to have severe withdrawal symptoms, which could lead to them using it more the moment they get out or using it more right now to like try to fight that withdrawal. So I think it has both effects. Both.
Yeah. I agree with Suhas because like a lot of parents, like a lot of my friends I know, their parents won't let them leave the house, and it kind of, if they have an addiction, it'll restrict their addiction. A lot of kids that have a strong addiction, they're going to have a lot of withdrawals, and it's just going to be hard for them without the supplies they need. So
Definitely. I think going back to Suhas's point, one aspect of addiction is the social addiction. I think in terms of being stuck at home, like Alina said, you're bored. You're not with your friends, so that social addiction is kind of taken away. So that might decrease the amount of vaping at home. Yeah. But also you could look at it that they're bored at home, like Alina said. So they have really nothing else to do. So yeah, that could increase the vaping use.
Yeah, so it could go either ways.
yeah.
It's easier access to vape.
And recently I read a paper by the National Health Institute, or the Department on Drugs and Narcotics. They're seeing more cases of like withdrawal of people going back to the drugs they used to use way back when. To them with time on their hands, they have no one out there to stop them. Vaping, like those kids who are trying to recover and their friends are helping them recover, now they're on their, so they can go back to what they used to be doing. So that's one thing you have to look at too.
Yeah, there's a bunch of different variables that can go either way. It's just like maybe the lack of peer pressure without like people that like you're not going to be exposed to vaping as much if you're like you said a light vapor, actually like a not vapor at all. Like you're not going to be going to the bathroom and seeing people vape in there. You're not going to be peer pressured, but also the aspect of being with your parents, like you're going to be with your parents longer periods, and it's going to be hard to get away from them during these social distancing times.
Yeah. And I think just to end on a less somber note, more of on a fun note, do you guys have any fun hashtags that you could share that give some hope to people who might be watching this?
About vaping or like in general?
It could be in general. I mean, anything just that gives hope. Maybe we could correlate to vaping, or COVID-19.
Maybe you can think about them and email to us later.
Okay.
Yeah, I don't know.
Yeah.
That's a little bit hard.
Maybe like
I don't know what would be a good one.
Well, I think there's a hashtag I like called like go do something, and then like hashtag invent calculus, because Newton actually in quarantine calculus, so they're telling people now like go out there and do something, go follow your dream when you have time on your hands.
Okay.
So
that's
pretty cool.
Yeah.
We could do hashtag go do something, and that would be like
don't vape, follow your dream.
Don't do bad things. Go do good things.
Yeah.
Hashtag go do good things, not bad things.
Hashtag go do.
Yeah.
Okay.
Well, I just want to thank you guys for joining us. It was great to see you guys again. Great to connect with
Me too.
members of our organization, just collaborate on a webinar like this.
Also, we need to find juniors for the college initiative because seniors can't do it this year due to all the colleges being closed down for the year. We had a lot of on-campus. So, yeah, we need to get the juniors in touch, and they need to take that over next year.
We'll continue to recruit and talk to our juniors for the following year.
Yeah.
When we'll hopefully get back to school. Well, thank you guys. I think that was a great meeting.
So today we have Catherine and Soham. And can you guys introduce yourselves and tell us a little bit about yourselves?
I'm Soham. I go to Woodward Academy in the 8th grade.
Catherine.
I'm Catherine Jeffroy, and I live in Augusta, and I go to Augusta Prep.
Okay. We're all going through this time right now through trying to cope with COVID-19 and staying socially distanced. What have been your guys' experience with social distancing and staying away from people? How have you guys coped?
Social distancing has been kind of boring, but I mean, I'm trying to think of what to say.
You're fine.
Guess you can go first.
Yeah, I can go first.
Yes, can you hear me?
Okay,
Yes,
now it's
okay.
working. Okay.
Look
Okay.
what happened. Okay.
Okay.
That's what I get for living so far away.
Yeah. Okay, so now that we're back, Catherine, how have you coped so far with COVID-19?
Boom.
Here,
I'm invisible.
yeah, I'm gonna remove your first, Catherine, because there's two cat. Okay, no, yeah.
There's two of me.
Okay,
All right.
okay.
All right.
Okay, so basically, Catherine, what have been your experiences with COVID-19 and your experiences with social distancing and staying with your family in your house and everything?
I mean, it's been quite a difference, I can tell you, for someone who gets bored really easily and has trouble just relaxing. It's definitely been it's something where you have to start structuring yourself around school and workouts. So
Yeah,
but,
it's definitely
it's a lot of homework, I can tell you that too.
yeah, to have like a schedule, just plan your day out step by step. I think we're all going through the same thing, so it's kind of cool that the whole world is doing this right now.
Yeah, it's not just us.
Soham, how have you coped?
It's been good. I agree with her. It's been extremely different. For middle school, it's been super easy. The schedule goes on pretty nice, and I just get to like sleep more and just relax, I guess. But it gets a little boring doing the same thing every day, and eventually like you run out of things to do.
Yeah,
Yeah, we think that's positive. Like you said, just staying at home. We think that staying with our family has been a really positive thing for us. Just having more time to what we might have not had time to do before.
yeah.
Yeah, just pursuing your interests, just spending time with your family. I think what we've done is we played a lot of poker. So,
Yeah, we've been playing a lot of poker recently.
That's
time.
Yeah, lots of poker.
With their grandpa.
Yeah,
Plus, online school is pretty easy. It's a lot easier than regular school to me.
Yeah.
I don't know about you guys, but to me, it's a lot easier than regular school. What do you guys think about online school?
Online school, like in middle school, we're just like
horrible.
we have like
So
5
hard.
classes.
Would you say Soho?
We only have like 4 classes, I think. Yeah, 4 classes a day, so it's pretty easy,
oh
and
yeah,
it's not that bad.
yeah. We think we definitely learn a lot more in regular class. I think
Yeah.
online learning, there's a lot of ways to.
I mean, I think it's just busy work, a lot of it. Like, some of
Yeah.
it's just busy work for online.
Mhm.
I'm not sure if
And how has been your online experience, Catherine?
Okay, so I woke up around 8, and I usually finish around like 6 in the evening. So sitting at a computer for a pretty long time.
oh, wow,
Yeah.
that's a
It gave
lot.
us a lot of homework and stuff to do. So we're basically teaching ourselves too. So
Yeah.
it's quite.
Ours is only max like 4 hours of work every day. That's not that
Yeah, I
bad.
heard you guys don't even have. Do you guys have Zoom meetings a lot or no?
No.
It's more of like review sessions. You can join if you want. They're not mandatory. Usually it's just like if you want to like
that's-
your teacher review.
Yeah, but we mostly just get the assignments. We kind of have to do our own research and learn it. Yeah,
You kind of self-teach.
yeah. Again, like Catherine said.
How are your AP exams affected?
AP
Well,
World
we're
is
still
just-
gonna take it, but we
they're
have
just structured differently. Like AP World is gonna have half of what is usually tested because they're not gonna count
Yeah.
from when we left school to the end of the year. So it's just gonna be like units 1 through 6, and they've sent out that it's just gonna be a couple like free response questions. There's not gonna be any multiple choice for AP World. Yeah, it's changed. I'm not sure about the other AP classes though.
well, we've seen studies being thrown around in the scientific community about vaping and how it might lead to worse effects with COVID-19, worse symptoms. What do you guys think of that? And what do you think of that it especially affects youth and young adults?
I think vaping can be pretty bad for all the COVID-19 going around because COVID-19 can cause pneumonia in the lungs. And as well, if you vape as well, it can lead to worse things. And they still haven't done all the studies about vaping. So, I mean, people could find out it could be terrible like 20 years from now, especially with the effects of like COVID-19. Because COVID-19 hasn't shown it leaves scars in the lungs forever.
And if
Yeah.
you already have
Like
damage in your lungs
damaged
from
lungs
vaping,
from vaping. It just makes the cases worse.
Yeah.
Because with your lungs, it's really hard to protect your lungs because your lungs inhale everything in your environment. So that takes into account like both first-hand vaping and second-hand vaping. So both of those can affect your lungs negatively and lead to worse outcomes with COVID-19.
Catherine?
Yeah, well, from what I've heard, or you can see it in the videos of Italy over in the hospital, patients are been hurt more than women, which to men being they're more common smokers, and because of vaping's ties to damaging of lungs, and as well as smoking, can never really lead in the right direction if you're damaging your lungs and become more prone to diseases that's COVID-19 and pneumonia.
Yeah, definitely. That's
Like
really
what you
true.
said about males being more having a higher probability of smoking. That's exactly what happened in China, because China, the majority of the cases were men, and that's because in China, most men smoke and very little women smoke. That's why like the COVID-19 deaths were mainly men, because these cases were in worse conditions for people who had either smoking or vaping backgrounds.
Yeah, and then in comparison to China, all 40% of hospitalized Americans for COVID-19 are actually between the ages of 20 and 54. And what we think, or what we attribute that to, is because of the higher vaping and smoking rates in those age groups, because we didn't see those numbers in China really. It was all the old, the young and young adults and teens. They weren't really affected. But now in the United States, we're actually seeing that they are being affected, and we kind of attribute that to vaping.
Yeah.
Do you guys think that social distancing has maybe decreased vaping use and maybe some other high-risk behaviors, or do you think it's actually increased use?
I think it's decreased because obviously with friends, there's no peer pressure to like vape, or there is no one like around you to like hand you like a jewel or something. So like like there's less access as
Yeah,
well. Like people that like people can't get like jewel pods because there's no one to go or nowhere to go.
that peer pressure isn't there. I think that also connects to that.
Yeah, that's what Alina said in the last meeting. That's what she said about that. She thinks that vaping and other high risk behaviors could decrease because of lack of peer pressure. But also the other hand to that is like, what if your parents are supportive of vaping and aren't as informed as we are on the dangerous effects of vaping? Maybe they like prefer that you vape rather than smoke or do other types of dangerous drugs. So they might be supplying it, actually increasing the amount of vaping. But there's like two sides to this, where like you can either be like someone that didn't really vape as much as others would in school and kind of just like back off now because they're not addicted. But you could also have people that are straight up addicted and are having withdrawals and having to go to the hospital or having to hide away from their parents, which is going to be hard now because of the social distancing. So it could be that too, because like it's just different ways that this could go out, like different variables.
And how do you, Catherine, see this?
Well, I could see it going both ways for how much social distancing is enforced on you. If your parents are more lenient about it, I mean, I think vaping use would increase because it's a stressful time for everyone, no matter how much you can hide it. A lot of people turn to vaping and drug use to cope with, being bored or not having anything to do. But then it could also go the other way, where vaping use would decrease because maybe your parents are really enforcing you to stay at home because of the effect of COVID-19, and you won't have access to vape products where you would if you could be out and about.
Yeah, I think Suhas talked about that too in the last meeting, and what I was thinking is that it does get kind of boring just sitting here at home being kind of trapped.
Yeah.
At your house, you might go outside a few times, but you kind of have to stay in this location. So that might attribute to a higher increase because, I mean, kids are bored and they might just hit a vape because they're bored. We talked with Dr. Galiat Satos, and this really does have to do with social distancing, but more with vaping and maybe how it might affect COVID-19. We've actually seen that he did a case study where someone developed hypersensitivity pneumonitis, and she wasn't a vapor, she wasn't a smoker, and the only high-risk behavior that Dr. Galiat Satos could attribute her symptoms to was secondhand vaping, because many people in her family vape.
Yeah.
So that's what he attributed to, and we think that's one of the first studies that we've seen that's actually found hard evidence to support secondhand vaping. So we think that's a great step in the right direction towards
Increased
awareness and maybe eventually legislation for that.
Yeah.
Because if vaping is being tied to the effects of as smoking does on your lungs, then, I mean, if you experience secondhand smoking, it'd have to be similar to secondhand vaping, the extent. And the chemicals released into the air, I mean, you can sometimes physically see the clouds of smoke coming out, It's like an industrial plant you could compare it to.
Yeah, a big cloud of smoke. You never know what's in there.
Yeah.
So to end on maybe a fun note, not as sad, thinking if you guys had any hashtags that you guys might think of to maybe bring some hope, or it doesn't have to be related to vaping, maybe COVID-19, but do you guys have any ideas?
Yeah, like an idea that Suhas brought up last meeting was like hashtag go do something good. Because like there's this hashtag apparently that what he said was like go do something, because a lot of people are really just like have a lot of extra time on their hands and pursuing like what they probably didn't have time to do before. But like he also attributed it to like don't go like do something bad with your extra time, like vape or like do drugs, because since you're all by yourself, you have it's a lot easier to do something negative towards your body or without anyone watching or going like standing over you if you're like if you're an adult living by yourself. So that was his idea of a hashtag, like go do something good. I don't know if like you guys might have an idea of a hashtag. Like it could be like about COVID-19 or vaping or secondhand.
I mean, honestly, sit on the couch, but
Don't vape.
Sit on the couch.
don't
Don't
vape.
Sit
Don't
on
vape. Couch over vape.
over vape. I like it.
online school for vape, virtual school for vape.
Do you have any ideas, Soham?
Well, I pretty much agree. Like, just couch over vape, I guess.
Couch over vape.
Couch over vape. Okay, yeah, that's pretty cool.
To it. So thank you guys for joining us. We had a little bit of dialogue here. It's great to see you guys again. So thank you guys for coming.
Thank you.
Yeah, thank you. Bye, guys.
Bye.
See you guys next time.
Bye.
So you must be Alani.
Yes, I'm Alani.
Nice to meet you. I'm Juan.
And
I'm
I'm
a
Marco.
sophomore at Beeford High School.
Yeah, we're twins.
Nice
And
to meet you guys.
Yeah, nice to meet you.
I'm just gonna wait for Anthony.
Hi.
That's my mom.
Yeah, we're
Hi,
just
guys.
We're just waiting for Anthony to join.
Today we are with Aulani.
One of the newest members of our organization.
Yes, and would you like to introduce yourself and tell us a little bit about yourself?
I'm Alani, and I am 14. I have been homeschooled since I was about maybe 5 or 4, and it's been pretty fun to be homeschooled. I've been on a lot of interesting field trips. I've done a lot of acting and a lot of voiceover. I've been on, if you've ever heard of it, I've been on the movie Little. I was an extra.
Oh, okay. Yeah.
And I was on a TV show for 2 years called World Stories with Mama Koku.
Okay. That's actually really interesting because you kind of bring like a fresh perspective because you're really the only member of our organization who's homeschooled. So you kind of already have, like, this has been a new experience for most of the members in our organization because of COVID-19. We've been at home learning at home through online learning. So maybe what have been your experiences with social distancing and staying at home? Because I'm thinking it must be a lot different compared to the other people we've talked to. Yeah.
Yeah, I haven't left my house since we found out that COVID-19 was here in Atlanta. And because you can't be too careful.
Yeah.
Because, like, I have a low immune system, and you just can't be too careful with, like, who has what. Because everybody's saying that people have COVID and they don't know it.
Yeah.
So, and I've coped by, like, playing video games with my friends and watching a lot of YouTube, Netflix, Disney Plus, stuff like that.
Yeah. That's something, what we've been doing really is playing a lot of poker.
With our parents, yeah.
Just hanging out with our family. We think that this time with COVID-19, it's given us a lot of time to just hang out with our family and do stuff that we might have not had time to do before because of school or extra. So in terms of social distancing and staying away from other people, has been different from how different has it been from your normal, I guess, everyday life?
Well, sometimes I go with my dad to work. Couldn't really do that much.
Yeah.
And me and my dad hang out every Saturday. Can't really do that
Yeah.
because can't leave the house. But besides that, it's not really much different because school, same thing.
Yeah.
Everyday life has been basically the same thing except for certain days. Can't really do field trips. That's about it.
And it's been a little bit different for us. Extracurriculars have been canceled because we can't leave the home, obviously.
Yeah.
And school is different. We have to do online learning. But yeah, it's been a challenge just to adapt. It's not cool, but I guess it's more comforting that the whole world is going through this.
Yeah.
So it's not like we're alone. So we've actually seen that coronavirus could actually the symptoms of coronavirus can actually be worsened with vaping use. There have been studies that have been thrown around the scientific community. We're just thinking, what do you think that vaping leads to worse outcomes with COVID-19, especially with youth and young adults?
I do agree that it can worsen the symptoms because vaping can cause the immune system to weaken, and your body would be able to fight a cold, let alone COVID-19.
Yeah.
So, and if someone does have it and they don't know it and they're sharing a vape with their friend or anybody, that's spreading it right there.
Yeah. That's a new way that we haven't really thought of, like just maybe the interaction that vaping leads to, like with your friend groups, like that could help spread COVID-19. And obviously, like if you're inhaling anything other than oxygen or anything that you're supposed to be inhaling, it's obviously going to damage your lungs. And the COVID-19 illness especially targets the lungs, causing pneumonia, and that just makes it vaping leading to worse cases of the coronavirus infections in teens and young adults.
Yeah, and we've actually been working with a doctor's named Dr. Galiat Satos, and he's actually just finished his own. He just did a case study on one of his patients that she developed hypersensitivity pneumonitis, and that was from secondhand vaping use. And that's crazy because that's one of the first cases of or something
that's been studied, like a published paper that has shown that
secondhand vaping use is a real thing.
Yeah,
that it can actually hurt people. Another we've actually done research in Dr. Alexei Kulikov. He's actually supported the fact that smoking can increase your chances of getting COVID-19 and also make your symptoms worse with result of it. Yeah.
Yeah, I agree with that.
Yeah, because vaping, it just damages your lungs. It creates scar tissue, and with COVID-19, that just makes it worse. So I think it's a pretty obvious thing that vaping can make your symptoms worse. Yeah. Do you think that social distancing has maybe decreased vaping use or maybe increased vaping use with kids stuck at home?
It has slightly change in vaping and other high-risk behaviors. Most teens that I've met and are scared to do certain things because they'd be at risk to get the virus. And some teens will try because some don't care. Some think it's just, it's whatever, I won't get it just by going outside and doing this and that and that. And percentages in vaping teens have gone down slightly since the virus was discovered for health and safety reasons.
Yeah, and I think a part of that decrease in vaping could be kids stuck at home, maybe making it hard to get supplies if parents know the negative effects of vaping, because you're going to be stuck home with your parents. It's going to be hard to leave and have some time off to be able to, get the vaping supplies and go with your friends and start vaping.
Yeah. That social addiction isn't there anymore. You're not able to hang out with your friends, and peer pressure, in addition to the social distancing, isn't there as well.
Yeah.
To end off on a happy note, we were thinking, we've been talking to the other groups in this webinar about maybe a hashtag that maybe could give some hope. It doesn't have to be. Do you have any ideas in terms of maybe a hashtag?
Yeah, it could be related to
with
COVID-19 or secondhand vaping or vaping in general. Yeah, or maybe kids just staying home.
It's kind of hard to think of on the spot.
Some of the other groups, one of theirs was go do something good, because there's a hashtag go do something. But Suhas, he said instead of going to try vaping, like to go do something good and productive with the extra time that we have on our hands. Like maybe follow your.
And again, it's kind of hard to think of it, but
Yeah, it is kind of hard to think about. I would think of something like go hang out with your family, like
yeah,
spend time with fam or something.
Yeah.
I like it. Yeah, we'll keep that. We'll write that
Yeah,
down.
we'll write that down and keep it.
So thank you for joining us. You gave us some really good insight on how you have coped with COVID-19 and having to stay indoors. Thank you. Yeah.
Thank you for inviting me. I appreciate it.
Yeah. Hope to see you next time.
Got it.
Thank you. Bye.
Bye.
Thank you. Bye.
Ish, is that you?
Hey, what's up, Ish?
So,
Hi, Smita.
Hi.
hey,
First of all, I just want to thank you guys for taking the time to talk with us about COVID-19, about vaping, and just how you guys have coped.
And it would be good if you guys could introduce yourselves and just say a little bit about yourselves and what you guys have been doing.
Okay, my name is Samhita, and I'm a freshman at Chattahoochee.
my name is Ish, and I'm a freshman at GSMST.
Great. So I just want to start off by talking about like what have your guys' experience what have your experiences been in terms of social distancing and staying away from other people?
I haven't really been doing much. I mean, I've just been staying at home, and like, I guess it's just been kind of boring, doing stuff at home, only doing just all your work, and then not being able to like actually meet people, just only being able to stay with your family. So yeah, it's kind of
Yeah, I've been staying at home like this entire time. Yeah, like she said, it's kind of boring because you can't like go out or like hang out with your friends. But like I'm alright with it because like I'm stopping the prevention of I'm stopping the disease, I guess.
Definitely, yeah. We're all in this together, kind of.
Mhm.
I mean, it kind of feels like not a family, but like you're not alone because the whole world is going through this right now, and we all have to do our own part in trying to stop the spread of this disease. We've actually, through our research, and we've been talking to some doctors. Do you guys think that vaping could lead to worse symptoms with COVID-19 in both youth and young adults?
I feel like that some aspects of it, like some ways teenagers are getting influenced by vaping, I think those are probably getting smaller because people aren't really meeting, so they don't really have a better chance of being peer pressured, and they can't really get, if they don't actually have a vape, they can't really get one because they can't go outside.
Yeah.
So I think that unless they're like really bored and they're like going outside, I don't think that many teens are actually like starting to vape right now.
Yeah, that's what Alina said in one of our previous meetings, because what she mentioned was that like not only do you need like a vape to be able to vape, but you actually need the e-liquid. And when you run out of that, it's going to be hard to go to a store and buy some because of the social distancing and the quarantine.
Yeah.
So that's what she said, basically running out of materials. And what do you think about it, Ish?
Because vaping like weakens your lungs. When you vape, it like your lungs get scarred. Coronavirus like causes a higher mortality for people who have like lung diseases or previous lung conditions. So if you vape, it puts you in a higher chance of death or mortality.
Yeah, what we've seen is, studies have shown that people who vape may have worse outcomes of coronavirus, like just basically like having a higher chance of dying in worst case.
It increases the ACE receptors in your lungs, and that's actually what COVID-19 attaches to cause harm. So it just increases your chances of catching the disease, but also having worse effects. Yeah. Do you guys think that social distancing has maybe decreased vaping and high-risk behaviors, or do you think it's actually increased campaigns?
I think so, because I think it's decreased in my opinion, because it'd be a lot harder to get the e-juice and like the vape without leaving the house because of social distancing. But then you're at home unsupervised a lot, so it can be both.
Yeah, that like going back to what Samita said, he was talking about the peer pressure and how that can affect the amount of vaping that a teen or young adult does.
Yeah.
Like there's not that social effect that there once was when we could go outside and hang out with friends.
Yeah. Also regarding high-risk behaviors, I think it's harder for someone to like, if maybe a little bit older or even if you're a teen, to do like hardcore drugs, because you're going to be home with your parents and you guys are going to be it's going to be harder to get away from them and like kind of in secret do drugs or vape or any kind of high-risk behaviors.
Yeah,
it's both. Like it could either increase or decrease. And what Alani said in the last meeting, she said she looked at some numbers and apparently like vaping, the numbers have dropped a little bit, she said. I think that's probably due to the kids who weren't as hardcore vapers. Like maybe they just vaped a little bit, like once or twice with their friends, and maybe they just stopped after they've been more supervised with their parents, and it's hard to get away from them. Yeah, and that's the main reason why some of the vaping numbers have dropped.
Yeah, we've talked to Dr. Galiatsatos. He's a Johns Hopkins professor, and he actually had he did a case study with one of his patients, and she actually developed hypersensitivity pneumonitis from secondhand vaping exposure. It's great that there's actually studies now that actually prove that there can actually be secondhand vaping. So what do you guys think about secondhand vaping, and maybe it's kind of on the spot, but what its effects on people, and maybe how it's changed now that we're isolated and not around people so much?
Well, I mean, I think I guess I think people like have like family members that vape, they could still be exposed, but I mean, a lot of kids that don't vape, I think secondhand vaping is just probably just not affecting them because they're not really being exposed to it unless they're like still staying around other people that vape.
Yep. Do you have any thoughts on that?
Yeah. So because of like the quarantine, it's a lot harder to get the secondhand vape in you. The effects of it. So I'm sure like the secondhand vaping has gone down. If there's research proving that it's harmful, then it's most likely really bad for you.
Yeah. And in the case of the study, the person that the female was exposed to was her boyfriend. So it could also be, if you're quarantined, it could also increase secondhand smoke if family members vape.
Oh
yeah. So either side. So it just depends.
Yeah, it's kind of a balancing thing.
Yeah.
It could increase or decrease. Thank you guys for joining. I think we had a great talk about vaping, COVID-19. How you guys have
kind of coped with the quarantine and everything.
Yeah. So thank you guys, and hope to see you guys again.
Yeah, bye.
All right. See you. Bye.
Thank you for everyone who's joining us. This is our first webinar from vaping attention prevention.
And stay safe, guys, and keep doing your part by fighting this coronavirus by staying home.
Stay at home.